as slow as possible, we can, get it. Today's topic is breast cancer. Most times when we as men hear of this word cancer, we tend to not bother ourselves to see it as a disease that affects women alone. But for the men who have connected to today's program, permit me to shock you that out of 100%, even though 99% of those who come down with breast cancer are women, the remaining 1% is left for the men. So please, our men, the rest assured know it today, men to get breast. So let's go in quickly to a general overview of this wonderful topic. I expect more people to join us. We have received a lot of requests for this topic. As a matter of fact, this topic is the one and only topic people have sent in requests that we should please discuss on it, and that is why we are doing it today. Cancer, by definition, is in which abnormal breast cells grow out of. So we have cells in the breast. So when they begin to mutate, they form what medical personnel call tumors, serous cells. In one of my lectures, I talked about autoimmunity. Even Dr. Chooks equally reiterated that fact, where normal cells, for reasons not clear, will begin to misbehave and become abnormal, and the body begins to attack such cells. So in the breast cells in the breast, so when they begin to grow control, that means they are mutating. If stopped early, they turn into tumors, and this cancerous. The bad thing with it is that at that early stage, they are not checked. They can into the entire body, and the life of the person is in danger. Breast cancer begins from the milk ducts or milk-producing lobules of the breast. By the time you zoom into the breast, you will see duct and you see the lobules that produces milk, where most of these cancer cells begin. This thing is that the disease is life-threatening, just said in my opening speech. It is life-threatening, but if it is detected early, the cells can be stopped or prevented from spreading in your entire body. In some cases, the cells, once they start expanding, you see them in the form of lumps or swellings that are thick within the breast. We equally have some cancers we refer to as invasive cancer and spread as far as your lymph nodes or as well as other organs of your body. Now, majority of the cancers of the breast, different types, majority of them, about 80% of the breast cancer are invasive in the sense that they can spread out of the breast and attack other organs of. Now, just like I said earlier, percent of those who come down with breast cancer are basically of the female gender. It's on record that 0.5 to 1% of breast cancer cases have equally been observed in. And the particular type we have seen in men is what we call the invasive ductal carcinoma. invasive ductal carcinoma. Now, so our male folks always felt or thought that this disease is purely affair. Please take note today to get cancer of the breast. Now let's look at the world generally to breast cancer. In 2022, the organization reported that there were 2.3 million women diagnosed with breast cancer. In just 2022 alone, 2.3 women were diagnosed with breast cancer. Now, out of this number, 670,000 died. 670,000 women died. Now, if you look at this figure, it is so painful, the number of beautiful women who have lost their mothers, husbands, who have lost their wives. The record is quite long. So it is not something we should an issue like this, breast cancer, should be top priority for all, not just health alone, even non-health personnel. Breast cancer should not be taken lightly. At the situation of breast cancer in Nigeria. That same 2022, World Organization reported that in Nigeria, cancer caused 70,000 deaths. That's the WHO report in Nigeria. So looking at the world now, zooming into Nigeria, Nigeria is beginning to record severe cases of cancer attributed to breast cancer. Now, if we look at the incidence of cancer in Nigeria, breast cancer alone accounts for 25.7% general incidence of cancer in Nigeria. One is cervical cancer, 14.6%, followed by prostate cancer. Then we have the non-Hodgkin lymphoma, as well as liver. As a matter of fact, our Superlife headquarters and its country director has informed for the next couple of weeks, as we do as this November 1st with breast cancer, we're doing a series on cancer. So then the next week we'll be looking at cervical cancer. Upper week we'll look at prostate cancer. And if time will permit, we'll look at the other types of cancer. Now, the mortality rate of breast cancer is quite high, because if you want to look at all of this I've mentioned in Nigeria, the mortality rate of is very high. It's still at that of and that of prostate. So the we are is a very, very important. Let's look at types of breast cancer. Let's look at the difference of breast cancer. Number one is what the medical refer to as invasive ductal carcinoma, IDC. Invasive ductal carcinoma. Now, invasive ductal carcinoma, about 80% of all breast cancer cases. Please permit me to reiterate this fact. Invasive ductal carcinoma accounts for about 80% of all breast cancer cases in women. This particular type of cancer starts from the milk duct. If you look at the diagram in front of you, for some of you who are using your phones, please, if you can just expand your screen a bit, clearly see the diagram of the female breast before us. Now, if you look at the duct, if you look at this diagram, the lobule, you see the nipple of the breast, then you find the duct. This particular type of cancer of the breast, the ductal cancer, starts from the duct. That is where it starts from. That particular area we have zoomed in towards the right of your screen, you see a normal duct, which is clearly for all of you to see. Then if you look downward, you are going to see a duct that has been invaded by cancerous. Now, in this case, invasive ductal carcinoma. Now, this particular type of breast cancer is very common in Nigeria. It is very common in Nigeria. The second type of breast cancer is referred to as lobular breast cancer. This particular type of breast cancer accounts for about 10 to 15 all breast cancer cases that are reported. You may say it is not much, but then it is still not this kind of cancer. Now, just as its name suggests, please kindly look at the same diagram of the breast. We are looking at the lobules, not the duct. The first we talked about attacks the duct. In the case of this particular cancer, lobular breast, it attacks the lobule. And the lobule is milk is produced. The lobules where milk is produced. So you can imagine having cells attacking the milk production base. And this particular one, just like the one that attacks, they are invasive. They can spread. They can spread. They can leave the breast, start from the breast and parts of the human body. So those are very dangerous. So this one is about the second most common cancer in Nigeria. The third breast cancer is what the medical personnel refer to as carcinoma. Ductal carcinoma. The DCIS, particular one, starts from the ducts. Are you getting it? It starts from the ducts, especially the male. If you look at the lobule passes through a duct. So I have expanded it for you to see. If you look at the left side of your diagram, your upper left, you are going to see the duct. I have expanded it. This particular type of cancer starts from the milk ducts. Good. Now, this particular type 2 is very, very common. Medical have equally they are seeing lots of cases with ductal carcinoma. Please, for those who are just coming in, we talked about the invasive carcinoma, invasive ductal carcinoma. Don't confuse this one that you're looking at with particular ductal carcinoma. The difference between this particular one, ductal carcinoma, does not spread beyond, unlike the invasive ductal carcinoma, beyond the milk duct and spread to other parts of the body. Please take note. Now, we have another type of cancer of the breast. This is quite interesting. It is referred to as triple negative breast cancer, TNBC, the triple breast cancer. This particular cancer is quite invasive, just like the invasive carcinoma. This one too is quite invasive, and it is very invasive and spreads more quickly than any other breast cancers I have mentioned. The painful thing with this particular type of cancer is that it has very few treatment options. And that is because they do not have estrogens and progesterone receptors like the other three. The other have estrogen and progesterone receptors. It is easy for doctors to do a prognosis and do a proper diagnosis and see how patients. But for this particular one, they are very, very stubborn, and they account for about 10 to 15% of all breast cancer cases. And the painful thing with this type is that it is very common with black that are from 40 years and above. So when we get to what can be done, you are going to get advice, especially if which of these four types that we have mentioned so that the patient is having. This today's lecture is really open our eyes to know preventive measures and how, for those who have already gotten any of these, what they should. Another type of breast cancer that we need to equally look at, the medical personnel refer to as inflammatory breast cancer, IBC. This type of breast cancer, initially it was rare. It is very, very common and fast growing. Issue there is that it starts like a rash on your breast. It starts like a common breast, and before you know it, the breast starts popping up, that's swelling. Overnight, you now find a normal breast bloated beyond swollen. So this kind of breast cancer has inflammatory breast cancer, and most you see redness. So one marked signs that those with inflammatory breast cancer will see is that the breast is swollen, while maybe the other breast looks normal. One of the breasts is very swollen and reddish. Then there's another type we must not confuse with inflammatory breast cancer. This type of breast cancer is called Paget's disease of the breast. Paget's disease of the breast. Please, there's another disease called Paget disease of the bone, which is a metabolic bone disease. The two should not be confused. Please don't confuse yourself with the other one that we refer to in medicine as Paget's disease of the bone. This one is called Paget's disease of the breast. They are not similar. One way you can identify Paget's disease of the breast is that if you look at the nipple and the areola, that's that round part of the breast, in some women, you find rashes that look like eczema appearing around that areola. Once you see such a thing like that, and it has a color, usually reddish in color, but in this case, it is not swollen like the one we saw earlier, inflammatory breast cancer. In this case, it is not swollen. Rather, what you are seeing, it looks like a rash, or what in some women looks like eczema appearing around the areola. Now, whether we like it or not, this type of cancer of the breast exists and is occurs in, it is seen in almost 4% of all breast cancer cases that are reported to hospitals. Now, this disease is very common with the elderly, especially those who have hit 50 and above, though we still see cases of this disease with those who are in their. So please, now, what the medical personnel do a lot is that for treatment, the best way to handle cancer especially finding a solution to any of these type of cancers, will depend on the type of receptors they have. The type of receptors they have. You know, one thing with these cancer cells, they make use of our hormones for growth. Our hormones help them to grow rapidly, like the estrogen and progesterone that are released. It helps them to grow. So you now find most of these breast cancers having either the hormone receptors, either estrogen receptors or progesterone receptors, or both. So the medical personnel use this type of receptors that align with these different types of cancer to now look at the best possible therapy to apply to the patient. Now let's look at the different stages of breast cancer. Another thing the medical personnel do again is to look at not just the type, not just the hormone it affiliates with, they equally look at the stage of development. So once a cancer cell is in stage 0, the disease is still non-invasive. What it means in essence is that it has not spread from your breast to other parts of your body, or it has not left where it is appearing to other parts of the breast. So at this stage, the disease is still non-invasive. And once it is at this stage, it is very, very easy for medical personnel to handle it. That is why we do admonish our women and even our male folks to constantly check their breast to ensure it is normal on a daily basis. You can feel it. You can feel it yourself. Once something is abnormal going on there, you know. Stage 1 is when there are cancerous cells in the breast tissues. But at this stage, you are beginning to feel a lump, though not big in size, but you are beginning to feel something is not right with your breast. Stage 2 is the cancerous cells have already formed and they've changed into tumors. Now, the swelling, the feeling, the sensation you are getting of the abnormal growth that you're feeling inside your breast, the size has gone up. The size of the tumor has gone up. You can even feel it when you use your hand, place your hand on the breast, and you try to massage it or feel it. You are going to feel that tumor, that something abnormal tends to be present there. And in some women, even under their arm, they can equally feel that too. Yes. Now, for stage 3, the breast cancer has invaded the other nearby tissues of the breast. Stage 3 is often referred to as localized advanced breast cancer. While for stage 4, the cancer has spread from your breast to areas like your bones, your liver, your lungs, your brain, and even your cervix. So the medical personnel, just like I said earlier, apart from the different types they have identified, apart from the different hormonal utilization that they make use of, they equally look at the stage it has gotten to now know the therapy to apply. Now, what are some of the symptoms of breast cancer? The first thing you are going to notice is a change in the size, shape, or contour of your breast. I've said that earlier. The second thing you will notice is that you find a mass or lump that you can feel inside your breast as you use your palm to rub on your breast. You feel this mass or lump. Then another thing again you may feel is that the lump is thick, and you know your breast was not in this form before. Now, another thing you get to see, just like we looked at those ones with colors, inflammation, you see an inflamed breast. Some you find rashes on the breast. Some you see color change on the breast. In some cases, you find fluid coming out from the nipples. Even we see this in men too. The 1% of men that have breast cancer, you find fluid discharge coming out from the nipple. Now, what are the causes of breast cancer? People who are older, say from 50 and above, have a high risk of having breast cancer. Women and people that are assigned female at birth. Women and those that are assigned as female at birth, because today we are really seeing some very funny scenario in our world where some children are born as females. Then when they grow up, they say they are males. So today the language is changing. So when medical personnel are now compelled to say that when this child was born, this child was assigned as a female. That means the medical personnel saw all the female genitalia, every reproductive system aligned with that of the female. Likewise for the male, there are males and males that are assigned as male at birth. Because today again we see males that when they grow up, they now say they are women. There are no more males. We see this a lot amongst the homosexuals and all this transgender, whatever that is going on in the world. So women and children assigned female at birth are more likely to develop breast cancer than the men. Now, in some cases, again, family history play a very pivotal role. If your parents, your siblings, children, or other close relatives have breast cancer, then there's every tendency that if you're not careful, since this is occurring within the family, you may stand the risk of developing the disease. But yet again, the medical personnel are there, the hospitals are there, our laboratories are there for you to do a quick check and douse every fear that you may have. Genetics play an important role with the issue of breast cancer. Up to 15% of people with breast cancer develop the disease because they have inherited genetic mutations. Their genes have mutated and they inherited it. One of the most common genetic mutation is BRCA1 and BRCA2 genes. So once this type of genes are inherited, such a patient stands the risk of developing breast cancer. Another condition that may trigger breast cancer is smoking. Today we see a lot of women smoking. I don't know what kind of lifestyle is that, but women that smoke, please know that they are predisposing themselves to not just breast cancer alone, but to other forms of cancer. We equally see a lot of women taking alcohols. I keep on reiterating this fact. When I go to parties and I see women taking alcohols and alcoholic beverages, I pity them. I feel sorry for them. They may think they are enjoying, but it is just a pity. Some of them end up in the hospital, and some that are not lucky die with the disease. Obesity is another factor. Please, we often in our weekly program, in all our health discourses, reiterated this fact that you should do as much as possible to always check your weight, check your BP, do all of these tests. Once you know you are gaining too much weight, please do as much as possible to see how you exercise and reduce your calories so that you save yourself from not just breast cancer, from other diseases that are linked to. Remember what earlier was mentioned. Now, some people in time past were exposed to radiation, either for one therapy or the other. Please, people should reduce the rate at which they expose themselves to radiation. There are some people, every small thing, they want to go and do radiation for tests. Every small thing they want because they have the money to spend. The more you get yourself exposed to radiation, the risks to some of these cancers developing, and breast cancer too will like such. Then we have those who do hormone replacement therapy. Are you getting it? Especially those who, for one reason or the other, the menopause have set in, and they are doing hormone replacement therapy so that they can still continue to see their flow. This one too can make women endanger themselves and risk themselves to cancer of the breast. Now, how do our medical personnel diagnose breast cancer? Now, one thing they do a lot is that they carry out physical examinations. They carry out physical examinations. You can do physical examination on yourself at home. Even the medical personnel, our nurses do advise this. They do tell women most times when they consult the hospitals. Once you wake up every day as a woman, as a man, please don't be in a haste not to check your breast. Please often check the breast. Look for lumps. Look for any abnormal growth. Is there an inflammation? Is there anything like a rash? Is there anything like fluid coming out from your nipple, even when you know you are not breastfeeding? Please do all this. Now, another examination that medical personnel do is what is referred to as mammograms. That's X-ray of the breast. Now, you can do yourself lots of good by visiting the hospital in the event you notice something that you're confused about concerning your breast. You are the owner of the breast, so you should know when it looks normal and when it is not looking normal. Another thing the medical personnel do a lot is what we call breast ultrasound. Breast ultrasound is often done. Breast magnetic resonance imaging scan, MRI, is done. Breast biopsy, where tissues are taken from the breast and they are taken for laboratory investigation to check whether all is well inside your breast. Then another kind of test that medical personnel do is what we refer to as immunohistochemistry, which is tests to check for hormone receptors. Don't forget, I told you the cancer cells make use of our progesterone and estrogens for growth. They love it so much. So most of these hormones are linked to these cancer cells. Don't forget when we talked about the triple carcinoma, we told you that one does not make use of these receptors, and as such is so dangerous and very little because it spreads rapidly and it kills a lot. Now, genetic tests can equally be done to identify mutations that cause breast cancer. So these are some of the ways medical personnel carry out breast cancer diagnosis. Now, the question we will now ask ourselves is, how is breast cancer treated? Now, one of the ways breast cancer is treated primarily is via surgery. And the different types of surgeries that the medical personnel employed includes, but not limited to these ones I've mentioned. Number one, mastectomy, which is the surgery to remove the breast and all the tissues surrounding the breast. This one, the breast is removed completely. Are you getting it? The breast is removed completely. And even the tissues, the lymph nodes, that as everything is taken out. Mastectomy. We have lumpectomy. Here, it is only the abnormal tissues or the cancers that are removed from the breast, not the entire breast. Then we have breast reconstruction. It's a particular surgical procedure that when a mastectomy has been done, where the complete breast have been removed, you now find the medical personnel either immediately or later reconstructing the breast using implants or sometimes tissues from other parts of the body, like the belly of the patient, to now reconstruct another breast. So breast reconstruction is done after a mastectomy had already been carried out. Please take note. Then chemotherapy, where drugs are applied, radiation therapy, where radiation is applied, immunotherapy, where the immune system is used to fight the cancer cells, hormone therapy, where the hormones we talked about are looked into to now know which of the drugs that can be applied, which chemo can be applied to deal decisively with they have identified. Then there's another thing called targeted therapy, which is the use of drugs and other substances to precisely attack the cancer cells and get them out. So these are some of the various ways the medical personnel, having done their physical examination, having done a mammogram or a breast ultrasound or an MRI or a breast biopsy or immunohistochemistry, can now determine which of these procedures. Don't forget, I had told you earlier, they would have checked at what stage the cancer had gotten to. Please follow my drift. Now, what are the treatment side effects? Of course, a lot of us are quite aware of some of the stories and even life cases we have seen, those who have undergone these therapies and yet never survived. Yet we still have to praise the medical personnel because we still have those who have survived. The mere fact that we have those that have died from it does not mean that the medical personnel have not succeeded or are not succeeding in this quest to reduce the number of deaths. So there are so many side effects from these therapies. I don't have to mention them. All of you listening to me, I know you know most of these side effects and even complications that are arising from cancer surgeries. Now, the question is, how can breast cancer be prevented? The most important thing, just like I keep on reiterating, is that you must learn how to carry out physical examination on yourself, not just the women. Please, the men, you to do that. I've just told you that you can get a breast cancer even as a male. Yes, we have cases reported in the hospital. So out of every 100 cases, and you have 99 women, one is a man. So please, we should not treat it with levity. Let's be serious. Make sure a mammogram is done or a biopsy is done for you to really ascertain if you are having cancer and the type. Now, just like I do in every of my lectures, the reason why I do this, where we talked, before we go into the Super Life product, where we talked about the herbal remedies for breast cancer. The reason why I do this weekly is to let us know that there is a lot God has given to us, especially here in Nigeria, especially in Africa. We have turned our back to nature. We have turned our back completely to nature. We don't love nature again, and that is why we are dying early. A lot of us, plants don't do well in our hands. All we know is to just go to the market and buy. Our forefathers were not like us. They were quite conversant of a disease, even though we call it cancer. They had different names, or they still have different names they call cancer. They were equally familiar with cancer. Now, the question we will ask ourselves is this: what were our forefathers using in the villages that our great-grandmothers never had this disease? The prevalence was not high. Even though they had it back then, the incidence as we see it today is higher than what they had back then. So what were they doing that we are not doing? Of course, they are familiar with plants that can handle this condition. Let's look at some of these plants. The popular aloe vera, the one that is grown in Nigeria, the species is called Aloe bateri. Now, If our forefathers were quite aware that whenever they are using this particular plant, they go for the older one, not the young ones. They pick the leaves of this aloe vera, the ones that are 5 years old. That means they plant this leaf, this aloe vera plant, and allow it to grow. And they utilize the one that are 5 years and above. Now, what they do is that you see them pick like 3 of the leaves. You see them with natural honey, 1 full bottle. Then you see them pick 2 bottles of their local gin in the village. They cut this aloe vera. I've seen it a lot, and I still see it tomorrow. They cut this aloe vera leaves, and you now see them mixing the honey and the dry gin. They blend it together, and every day, twice a day, you see them taking 3 tablespoonfuls twice a day for 2 months. And before you know, you see these our mothers in the village looking very healthy. In some communities, coconut water they use mixed with honey. So, but today, what are we doing in the cities? We have forgotten all this. But because we have forgotten, Super Life loves us so much. So we need to thank Super Life as a company, because they still don't want us to die early. They still want us to live like our forefathers. And today, there are therapies like for breast cancer. What are the products we have for breast cancer? The STC30, the SNC, and SIC. Now, if you look critically throughout my discourse today on breast cancer, I kept on telling you that breast cancer developed from cells that started behaving abnormally inside your breast. Now, if there are cells misbehaving, and we now have products that are stem cell based, like the STC30, SNC, and SIC, what do you think these 3 products will be doing? Of course, once these regimens are followed religiously as prescribed by our expert doctors, please, let's give kudos to our amiable, wonderful doctor that has really been doing a yeoman's job for Super Life. He's a recognized medical personnel, Dr. Chooks. We have our pharmacists that came for some of our programs. We have a lot of pharmacists, doctors in Super Life, and we must commend the doctors and pharmacists in NAFDAC that conducted the various tests on this product and found out that it is not just stories we are telling, but that this product do what they claim they do. So how do we administer Super Life 30? Now, for those who are having breast cancer, please, just like it was advised in our manual, make sure a physical examination has been done, make sure a biopsy has been done or a mammogram, and it is established that you have a breast cancer. Leave the doctors, they will be the one to now know which type they are dealing with and at what stage it has gotten to. Whatever therapy you are on, please ensure when you are not on that therapy, that is when you are taking a product. Don't mix the drugs, whatever drugs they're giving to you, don't mix it together with the Super Life product. The Super Life products are purely plant-based stem cells, just like you taking the drugs you've been given in the hospital and you now go to eat okazi soup. Whether we like it or not, the okazi or lubo that you are taking is herbal, is medicinal, and they are purely from plants. Likewise, this product. So don't be frightened. How are you meant to take STC and SIC? You take STC 30 and SIC morning and night for 24 to 36 weeks. Morning and night. So while you are taking STC 30 and SIC morning and night, you are equally expected to take your SNC only once daily. But that depends on when your orthodox drug have been prescribed to you. So once you've been given an orthodox drug, please, we will advise you see the Super Life consultant to advise you appropriately on how to use the one given. Already you've been told from the hospital how you can utilize Super Life products. But one thing I can convincingly tell all of you that are listening today is that we are not making this up. We are not giving you this lecture weekly to just educate you. We are giving you these lectures weekly to help you and to see how you can help others. We must do our part, our best, to reduce the incidence of breast cancer. A lot of people, from the statistics you saw, the Nigerian statistics, the statistics are frightening. We cannot continue to keep our hands akimbo and pretend that all is well. Please, all is not well. Super Life Nigeria is doing a yeoman's job in bringing these educative lectures to us weekly. We should do our part in ensuring more and more people key in into the Super Life idea and see how we can save those who are dying early in their 40s, in their 30s, even in their 20s, to cross life expectancy age in Nigeria, and let us be at par. Today in the United States, they are recording high rate of people that are 100 years plus. The rate has gone up in the United States. It has gone up in the whole of the Asian continent. What is wrong with the sub-Saharan Africa, especially Nigeria? Please, may we not remain docile and die early. Once again, I want to appreciate all those that have zoomed in to receive today's lecture. I thank you so much, and I appreciate Super Life for giving us this wonderful and rare opportunity. It is me, Dr. Ibe, signing out. Thank you.
Wow, 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 wow. Life is super. Thank you so much, Doctor, for that expository, lecture on about breast cancer. Like you rightly said, breast cancer is generally associated with female, but you were able to educate us better that also men can also have breast cancer, though the cases might be, the percentage might be very low, but I've seen that as well. Practically, men having a breast